My name is Danisha Moore. I am the sexuality educator and peer education coordinator at McKinley Health Center. My job kind of consists of doing some individual one-on-one work as well as lots of outreach on campus. In terms of individual one-on-one work, I do see patients or students individually to talk about sexual functioning, healthy relationships, contraceptives, anything in that realm of sexual health. You can come in to talk to me about that and we can do some one-on-one sessions. In terms of outreach, I do have a sexual health peer education group. That is a group of students who go on campus and do comprehensive, sex positive, medically accurate sexual education. So a lot of my job really just entails doing lots of outreach and then meeting with students one-on-one to talk about sexual health. So we'll start with our external and internal barriers. I'm gonna go ahead and actually pull these out so you guys can see what they look like. But this here is an internal condom. Sometimes we also call these female condoms. That might be more of a term that you know, but we try to move to more internal condoms because we don't wanna make it seem like these are just for anyone who identifies as female. So this is what an internal condom looks like. You pretty much have a ring in here. This pretty much keeps it secure and keeps it locked onto the cervix. And then you have this outer layer of the internal condom. This pretty much wraps around the labia of the vulva to help with protection from that skin and skin contact, because you still can get STIs if you do have any type of exposure skin to skin. Also comes out this little ring, because you can also use this for anal sex as well. It can be used for vaginal sex or it can be used for anal sex. Very interchangeable. This is your dental dam. This is also a external barrier that we use for oral sex or oral sex on the vulva or the anus. Very flexible, so you can maneuver it. Doesn't matter how big, how small you may be. You pretty much just lay this over either the vulva or the anus, and this protects you from getting any type of STI. If you do not have a dental dam or don't have access to these, you can also use a external condom and pretty much just cut off the tip, cut down the middle of the condom, and it turns into a square. There you go, your DIY dental dam. And then also, we all know what these are. Very familiar with our external condoms that are usually more used on those who have penises. These are also very good to use, very common barrier that we use mostly. These can also be used on sex toys as well for any protection from any type of STIs or just exposure to any type of fluids, bacteria. I will now kind of move into our lube. You have silicone-based, water-based, and oil-based. So this here is a water-based lube, as well as this one. This is also a water-based lube. So when you're having sex and you're choosing to use this because you might be more sensitive or this might just be more of a preference for you, make sure you're always reapplying every time it starts to dry up. This can be used with condoms as well as sex toys. They will not do any damage to sex toys or any types of condoms. This is a combination. This is like a hybrid lube. This has a combination of oil and water-based. Oil is another type of lube that you can use. We don't really recommend using oil-based lubes with condoms because they can tear up the condom. You don't want that because you'll increase your risk of getting pregnant or increase your risk of getting an STI. But these can also be used if you just want to try a hybrid of oil and water-based. Last, we have your silicone lube. So this is probably familiar to you guys if you got any lube from the pharmacy. This is a surgical lube, but also a silicone lube. Silicone lube does not break down the condoms. You don't have to worry about it tearing or making any rips in the condom. You don't have to worry about silicone lube breaking down the material of your sex toys. So we usually recommend this as the most common lube that people do use. But just so you know now, there are different options that you can use in terms of silicone, water-based, oil, or hybrids. This here is contraceptives. This is essential as well because this has to do with family planning and also how helps you with kind of building confidence with your sexual decision making. This is something that you can use and it's up to you. Birth control can definitely be used unique to your body, so choose the birth control that is best and fits your body. Just to give you some names, this is an IUD right here, which is one of our most common and most effective ones. We have right here is the calendar or schedule for Depo, which is your Depo shots. This is your Nuva ring. This is your patch. which is not used very often, but some people prefer to use the patch. This is your patch here. The ones you don't actually need a provider to give you a prescription that you can find over the counter are your spermicide, your vaginal gels, as well as your emergency contraceptives, your Plan B, which are usually pretty common and we know about those. But the ones you'll need a provider to actually give you some type of referral or any type of order to get it are your IUDs, your diaphragm, oral pill, cervical cap, NuvaRing, Depo, patch, and implant. My fourth essential is obviously our sexual health resources. This is a sexual health resource guide that has been created by myself. This has a bunch of different resources in it specifically for sexual health. So if you're looking for a counselor, a therapist, there's some information on here. If you're looking for just a space where you can go, if you're a part of the LGBTQIA+ community, there's resources on here where there are some affirming spaces that you can be a part of. There's also stuff in here about resources in terms of locations where you can get STI testing done, where you can get hormone therapy medications or any type of medications for like PrEP and PEP. So these are some really good resources here, as well as our good old McKinley Health Center resource. This is great and very important to know about this because this is where you can get lots of free items, specifically your condoms and your lube, where you can get these free from the self-care stations. Thanks for tuning in. If you have any questions about anything that I talked about today, or if you just have questions where you can access any of these resources, you can reach me at the McKinley Health Center. You can either schedule an appointment via phone, you can come in person and schedule an appointment. If you see one of our providers and have any type of sexual health concerns, or you're coming for STI testing, a provider can also refer you to come and see me. Please follow us, Sexual Health Peers, at SHPUIUC on Instagram. So those are some ways you can kind of get in contact with me or at least stay up to date with what we have going on with our sexual health program.